Hello, and welcome to today's presentation, Naloxone Administration Training for the End User, brought to you by Healthy Connections. Today's keynote presenter is Lindsay Acree, who is a pharmacist in charge with the PharmUC Patient Care Clinic and the University of Charleston School of Pharmacy and an assistant professor with the Pharmacy Practice Department. We are recording today's presentation, which will be archived and available for later viewing. You can also interact with Lindsay by submitting your questions using the Q&A box in your WebEx player. If you don't see the Q&A box on the right side of your screen, simply hover over the three dots next to chat and you can bring up Q&A and submit your questions at any time. We'll get to as many as time will allow for today. In addition to Lindsay, I'm Shannon Wright, Director of Innovation for Quality Insights. I'll be emceeing today's event. Misty Dyke is a Communication Specialist for Quality Insights who's producing today's webinar, and Lead Project Coordinator Crystal Welch will be facilitating the Q&A process a little later in today's presentation. For those of you who may not be familiar with Healthy Connections, we're a coalition that helps pregnant women, mothers, and families navigate treatment and support services available in the community. We're based in Huntington, West Virginia, and include more than 30 Huntington area agencies, all working together with a shared mission and goal. Today's webinar is being produced by Quality Insights, a Charleston-based organization that's one of the largest nonprofit organizations devoted to improving healthcare quality in the United States. We use data and community solutions to achieve the goals of better care, smarter spending, and healthier people. Our 300-plus employees and consultants have a wide array of experience, including healthcare delivery, continuous quality improvement, medical record abstraction, data analysis, information technology, social marketing, and more. Quality Insights' role in Healthy Connections includes providing the group's marketing, branding, web infrastructure, partnership coordination, resource creation, earned media, advertising, and webinar production, just like the webinar you're viewing today. Our keynote speaker is Lindsay Acree. She is an assistant professor at the University of Charleston School of Pharmacy. She received her pharmacy degree from the University of Charleston School of Pharmacy in 2013 and completed a PGY1 residency in academia and ambulatory care, also with UC. Dr. Acree provides patient care in several clinics throughout the Charleston area, including the City of Charleston Wellness Clinic and the Family Health Associates of South Charleston. Dr. Acree is a board-certified asthma educator. Her involvement with the Harm Reduction Clinic located in the Kanawha Charleston Health Department includes teaching the naloxone training to patients, caregivers, and members of the community, as well as assisting with harm reduction services. In addition to clinical services, Dr. Acree teaches several topics within the university, such as substance use disorders, asthma, COPD, and tobacco cessation. Without further ado, it's my great pleasure to turn today's presentation over to Dr. Lindsay Acree.
Thank you so much for that introduction. What we'll do today is go through naloxone training. So by the end of the training, you should know how to use naloxone and when to use naloxone. So we'll talk about what an opioid is, as well as how to use each version of naloxone. So there's 3 different versions that we'll talk about today. We'll talk about when to use it, so how to recognize an overdose. And we'll talk about additional steps that need to occur after naloxone is given. So making sure that you call 911 and making sure that you stay with that individual. So things like that. So we'll talk about those continued steps that need to happen after administration. And of course, as Shannon mentioned, please feel free to put any questions that you have in the Q&A section, and I'm happy to answer those at the end of the session. So we wanted to say thank you for taking the step to learn how to use naloxone, and we will provide you with steps to be able to receive a free naloxone kit after this training. So I will provide those to you via email. So with your email information that you provided through the sign-up list for this training, I will email you a copy of your certificate as well as a list of locations where you can pick up your naloxone. But again, thank you so much for taking this step, because with naloxone on hand, so you having naloxone with you, you can potentially save a life. And I just want to, again, thank you for taking that step. So if you do administer naloxone, so let's say you get a kit and you happen to administer it and you need another kit, again, you'll have a list of locations where you can pick up naloxone. Now that you've been trained, that's great. Luckily, you know, you can go in and show your certificate and hopefully get another kit as long as they have them available. Storage for naloxone is really important. So it's important that you keep naloxone where you can access it very, very easily. So making sure that if you have someone in the home that is at risk, that you keep it somewhere that everyone in the home knows how to get to it and how to use it. If you keep it on your person, if you are a person at risk, make sure that your friends and family members know where you keep it and how to use it as well. Because if someone can't find it or if someone doesn't know how to use it, it really doesn't do any good. So just make sure that everyone around you knows how to use naloxone and where you keep it. In addition to kind of keeping it accessible, make sure that you don't store your naloxone anywhere around extreme temperatures. So you don't want to leave it in your car, for example, when it gets really, really hot or really cold where it could freeze. So just make sure to keep it, you know, like in your backpack or a purse or something like that where you can access it, or again, in like a medicine cabinet at home. So what is an opioid? So I think most people know what an opioid is by now because we see it so much in the news and, you know, through social media. But opioids are typically drugs that reduce pain. So whether that is a prescription medication like hydrocodone or oxycodone, or if it's an illegal an illegal drug like heroin or some versions of fentanyl can be illegal. All of those are still opioids. So regardless of whether it's a prescription or an illegal substance, they all really work the same way in the body. So they all bind opioid receptors in the brain. And the reason that that's important is because that's also where naloxone is going to work. So if someone has overdosed on an opioid, whether it's heroin or prescription hydrocodone, naloxone should be effective for all of them because it's still acting in the same place in the brain. So now kind of looking at how to recognize an opioid overdose, because naloxone is only effective if that person has overdosed on an opioid. So there's really two things that we look for in an opioid overdose. The first thing is that you can't wake that person up, so they're non-responsive. And so to check for that, you can kind of tap them, you can even lightly, you know, shake them, shout, do things like that to try to wake them up. If none of those things work, you can take your knuckle and run it along your breastbone with some pressure, or run it along their breastbone with some pressure. When you do that, it is not very comfortable and can cause a little bit of pain. And so if someone is in a deep sleep, typically they'll wake up. If that person has overdosed, that's not going to faze them, okay? So if they don't respond to what we call a sternal rub, when you rub it right along your breastbone, they don't respond to that, we consider them unresponsive. The one thing that I do want to caution you on is when someone has overdosed on an opioid and you are using that sternal rub to try to wake them up, only do that to check for responsiveness. Once you've administered naloxone or once you've started rescue breathing or anything that could be life-saving measures, you don't want to use that sternal rub to try to continue to wake them up. The reason for that is, like I said, it can be kind of painful. And so sometimes individuals, when they come out of an overdose, can be a little bit aggressive or scared. And if you're causing them pain, that can cause them to maybe potentially be a little bit more aggressive. So I only say to use that sternal rub to check for responsiveness. And then the second thing that we look for is that person is either not breathing or not breathing well. So when I say that someone is not breathing well, what you want to look for would be that maybe they're not breathing very often, or maybe they're taking very shallow breaths. Either way, if they're not breathing well or not breathing at all, they're going to start to turn blue. So blue lips, blue fingertips, and kind of like this gray pale tint to the skin. So if they're starting to get that blue tint and the gray tint to their skin, the blue tint to their lips and fingertips, then you want to assume that they're not getting oxygen. And there's a lot of things that can cause that, but the great thing is that naloxone is pretty harmless. So if you give naloxone to someone that is not overdosing, you're not harming them, but you may not be helping them, okay? So again, if those two things are present, so not responding to you and not breathing or not breathing well, and you suspect that it could be possibly an overdose and you have naloxone, please use it because you could save their life. So this is a list of opioids. This is definitely not all of them, but the ones that I like to point out are fentanyl and carfentanil. The reason I point these out is because they are extremely potent. Fentanyl, for example, is about 50 times stronger than heroin or 100 times stronger than morphine. The reason that this is important is because this is now being mixed in with a lot of other drugs. More often than not, we see heroin with fentanyl. So heroin is actually cut with fentanyl very often, and so it actually increases the potency of that heroin, increasing the risk of an overdose. Also, we see fentanyl sometimes mixed in with other drugs like methamphetamine, marijuana, cocaine, and when that's the case, the individual thinks that they're getting one thing, but it also contains a really potent opioid, and so that causes a lot of overdoses as well, and mixed with other drugs can cause a lot of other issues for that person. So a lot of times if we see an overdose and we're not really sure what they took, or maybe you think you know what they took, and maybe it was, let's say, cocaine, for example, but then if they become unresponsive and not breathing, there is a chance that that could have been laced with fentanyl. So when in doubt, again, if those two things are present, so not breathing or not breathing well, not responding to you, and it's a potential overdose of some sort, if you have naloxone, please try to use it. Carfentanil, the reason I wanted to mention this one as well is because it's very similar to fentanyl, and it's 100 times stronger than fentanyl. So, like, as I said, fentanyl is 50 times stronger than heroin, and carfentanil is 100 times stronger than fentanyl. So very, very, very potent. So just something to be aware of, that oftentimes we see lots of drugs laced with other products. So how does naloxone work? So naloxone essentially is going to kick off the opioid off of the brain, okay? So in an overdose situation, if you think of the brain like a parking lot, and those parking spaces are kind of like that opioid receptor. So in that overdose, all of those parking spaces are full, okay? So if one car backs out of a space, there's another one there to take place, okay? So everything is kind of overloaded. The brain is overloaded. When you give naloxone, it's going to kick all the cars out of that parking lot, and it blocks the gate. So what that means for the individual that you've given naloxone to is that you have kicked off all of that drug off of their brain, and that allows them to breathe. But that's also the reason that we have side effects from naloxone, because when all of that drug is pushed off of the brain, that causes that person to go into withdrawal. That is what allows them to breathe, but that's also what causes some of the side effects, which we'll talk about in just a few moments. The other thing to note is that naloxone wears off. So naloxone will wear off somewhere between 30 minutes and 2 hours. And when naloxone starts to wear off, that drug that they've overdosed on can get back to the brain. So think about that parking lot scenario again. So the gates open up and all those cars can come back, okay? So it's really important to call 911. It's also extremely important to stay with that person, okay? So we know that in the community, a lot of times individuals are not contacting EMS. We want to, encourage everybody to call EMS or 911 for lots of reasons, but it's really important that no matter what, someone is staying with that person, whether EMS is called or not, to make sure that they don't stop breathing again, because that can happen as soon as that naloxone wears off. So when that person starts to breathe again, so if they start to breathe or breathe better on their own, then we know that the naloxone has worked, even if they're not awake. So if they're starting to breathe and breathe better, but they're still unconscious or not responding to you, that's okay. when the breathing starts, we know that the naloxone did its job and we stop giving more naloxone, okay? But again, stay with that person, wait for EMS, just to make sure that, they're going to be okay. It's also recommended not to put the person in ice water or an ice bath or anything like that. We often see this done in the community to try to, bring people out of an overdose, especially if they don't have naloxone, but it actually causes more harm than good. So we'll go over things that you can do with or without naloxone that can potentially save that individual. There are 2 doses in most packs of naloxone. So if you purchase naloxone either in a pharmacy or if you receive naloxone from a health department, typically there's going to be 2 doses in that pack. There's a couple reasons that there's 2 doses, but oftentimes it takes more than 1 dose to bring someone out of that overdose. It's really important to make sure that you have at least those 2 doses with you, just in case you need them both. Sometimes it takes more than those 2 doses, and if you have more than 2 doses, you can administer more than 2 as long as you called 911 and someone is on their way. But again, calling 911 is extremely important because even sometimes it takes more than 2 doses. So if you only have 2 doses and you've used those 2 doses on that person, you need to make sure that someone is at least on their way to provide more if it's needed. So this is a checklist that I think is probably the most important slide in this entire presentation. This gives you step-by-step what to do in an overdose situation, okay? So this is something that if you can kind of put this in the back of your head, or when you pick up your naloxone, you'll be provided with a brochure that has the same checklist. But this is something that, you can save a life with or without naloxone by doing rescue breathing and things like that. But this gives you step-by-step what to do so that in that scary moment of someone being in front of you and they're not breathing and they're not responding to you, that you can help them. So the first step is really just getting the person down to the ground, okay? So if you can get them down to the ground and put them flat as you can, and tilt their head back, so open that airway, just as if you were about to give CPR or do rescue breathing. You want them in that same position. Now, it's not always that you can get that person into that position safely, and if you cannot get them down to the ground on their back with their head tilted back slightly, then at least try to, as safely as you can, open their airway by kind of straightening out the neck if you can, or even tilting the head slightly back, of course, again, as best as you can without hurting that individual. But sometimes, as I mentioned before, sometimes people are breathing a little bit, so they may not be breathing well, but they're still breathing. And so if you open that airway, oftentimes that allows enough oxygen to get in to help them at least, have some oxygen going to their brain and to their other tissues. I did see a question pop up about the slides. Do we need to stop and hold on to see if the slides are not showing?
The slide should be showing. I'll communicate with Bobby here.
Okay.
And
I just wanted to make
sure.
Okay. If I needed to stop, I just wanted to make sure. Okay. So once you have that person down to the ground and their airway open, the best that you can, then you want to make sure that you call 911 or have somebody else call 911. Then you want to administer a dose of naloxone. As soon as you administer that dose of naloxone, you can begin rescue breathing. If you know how, you feel comfortable, and you can protect yourself. So there are little barriers that you can purchase. Some health departments carry them to hand out with the naloxone. But if you have it's a CPR barrier that you can put kind of between you and the individual, you can actually do rescue breathing and protect yourself at the same time. So again, you can administer that dose of naloxone, provide rescue breathing if you feel comfortable and know how, and do that for about 3 minutes. And in 3 minutes, if they're not breathing on their own and breathing better, then you want to give another dose of naloxone. So you would take another one out of your box and you would administer a second dose. Okay, and then again, you can continue to do rescue breathing until you either need to give another dose of naloxone or until EMS arrives or until that person starts to breathe on their own. But typically, the thing to remember is 3 minutes. So 3 minutes between doses. As soon as that person starts to wake up or starts to move or breathe or show signs that they're coming out of that overdose, you want to put them onto their side in the recovery position. And that's with their knee up. And usually you want to have their hand kind of under their face just to keep them from rolling over onto their face and not being able to breathe. So put them in that recovery position and then put some space between you and that individual. Putting some space between you protects you if, as I mentioned before, maybe they come out of that overdose a little bit aggressively. So oftentimes people go into what's called a fight or flight kind of response. So they wake up, they're scared, they don't know what happened, they don't know who you are, and they don't know what you're trying to do to them. So they may think that you're trying to hurt them, and their first response is sometimes to fight or to be aggressive. And so the best thing to do is just put them onto their side and back away in case they come out of it scared and afraid, okay? Also, that protects them if they start to vomit. So if they're on their side and they're vomiting, they're safer than if they're laying flat on their back, because if they're flat on their back, they can breathe that in and damage their lungs, okay? And then again, stay with that person until EMS arrives. Make sure that you've called 911, that someone is on their way to help that individual. So again, naloxone wears off. It's extremely important that someone stays with them until EMS gets there. And even after, if EMS leaves, it's really important that someone stays with them for a while to make sure that they're okay and that naloxone doesn't wear off and they don't stop breathing again. So naloxone is only effective for opioids. So if they've taken anything else, so if they've overdosed on meth, for example, or a combination of alcohol and a benzodiazepine, for example, then naloxone is just not going to work. So it doesn't hurt them, but it doesn't help them. So side effects. As I mentioned before, the side effects come from putting that person into withdrawal. So if that person has overdosed and they are physically dependent on an opioid, meaning they've been taking it for a period of time and their body has become dependent on it, then when you give naloxone, they will go through withdrawal, okay? So things like runny nose, sweating, a fast heart rate, high blood pressure, shaking, nausea and vomiting, as I mentioned already, rapid return of pain, and then again that agitation that sometimes can occur when they first come out of that overdose. So all of these side effects are because that person went into immediate withdrawal. If this is a one-time exposure, because I get this question a lot with like children, so how safe is it to be used in children? In children, often it's a one-time exposure. And if this is a one-time exposure, that child is not physically dependent on that opioid. So they won't have withdrawal effects. Of course, it just helps them start to breathe again because it does still kick it off the brain, but they don't typically have the sweating, the fast heart rate, the high blood pressure, all of those effects that we see when we put somebody into withdrawal. But don't let the fear of putting somebody into withdrawal keep you from using naloxone. Because yes, they might be upset with you at that moment, they might be mad, whatever it may be, but that is one more day that they're alive. And that's what we're here to do, is to save lives. As I mentioned before, always call 911. You'll hear me say that about 18 times throughout this presentation because it's extremely important that you make sure that you call 911 for a couple reasons. But also, if you use your naloxone, so if you use your naloxone to save somebody's life, you want to make sure that you report that to poison control. And so the phone number is listed here. So you can call poison control, and if you want to remain anonymous, you can. They don't ask you for personal data from that individual that's overdosed. It's more approximate age, what you think they took, how many doses of naloxone, those types of questions. So they don't ask for any personal information from the person that you have revived. The other way to provide this information is when you go to get a new kit. So if you are planning to go to the health department to report that you used your kit and to get a new one. They have a form that you can fill out, and then they can send that in for you. So just let them know that you've used your kit and you need to fill out the poison control form. This is required to be reported, but for the other standpoint of why it's important, just think about, all the community naloxone that we have grants for, and we just want to make sure that we can show its benefit of getting it out into the community. And the only way to do that is really through this reporting through poison control. So it helps us get money into the state to help provide more naloxone for free. So there are 3 types of naloxone that we're going to talk about today. So the first is FZO. This is an auto-injector. It goes into the outer thigh. It looks, if you look in my little webcam, you can see an image of it here. So you never see the needle. It's a very simple device to use, but it is an injection. It's 2 milligrams as the dose. The other one I want to talk about is the naloxone nasal with an atomizer, which comes in 3 pieces. So again, if you look into the webcam, it's kind of hard to see with me holding all 3 at once, but it does come in 3 pieces, so you do have to assemble that one. Again, this is a 2 milligram dose, but because it's a nasal spray, the individual only absorbs about 25 to 30% of that dose. And then the last one we're going to talk about is the Narcan Nasal Spray. This is a 4 milligram dose. So this is the highest dose, but the person is actually going to absorb about 50% of this one. So it's pretty equivalent to that auto injector as to what that person actually absorbs. And again, if you look in the webcam, you can see an image of that product as well. All of these devices can be used in adults and children. So they've all been studied in both adults and kids. They are safe to use in any age. And again, the benefit of saving the life outweighs the risks associated with use. So all of these devices, again, can be carried in a purse, a backpack, stored in a drawer, cabinet, medicine cabinet, wherever you want to keep it, wherever it's handy is where it needs to go. It is not illegal to carry this on you. This was actually something that was added into legislation this year, was to make sure that it is specifically stated that it is not illegal to have it, even if you don't have a prescription for it. And then all of these devices should just be provided to EMS after you use them. So if you, revive someone, so you've used 2 doses on someone, when EMS arrives, tell them that you used the 2 doses. You can give them to dispose of them. But also, if you've been writing down the times that you gave them, it would be important to go ahead and tell them the times as well. So the first one that we'll go over is the FZO product. Again, this is the auto injection. I'm going to kind of demonstrate it up in the webcam, but I first want to just kind of explain how it comes. So if you look in the webcam, you can see that it's all one piece. Okay, so when it comes out of the box, it's all one piece. This is a trainer. It's black and white. Okay, so this has no medicine. It has no needle, no way to actually administer this. Okay. This is just a trainer to demonstrate how to use it. The reason I'm kind of being very specific about pointing that out is that if you use this on someone, it's not going to save them. You have to use the ones that look like the one on your screen that's blue and purple. So these are the actual doses. But what you see on your screen is what it looks like once you take it out of the sleeve, okay? So, when you pull it out of the box, it's going to look like it does in the webcam up here. It's just going to be blue and purple for the live dose. And then once you pull it apart, then it will look like it does on your screen. Again, this is a 2 milligram dose. This device does talk you through the entire process. So what I'm going to do here in a second, after I explain how to use it, is I'm going to demonstrate it. So I'm going to actually take it off and let you hear kind of how it goes through the demonstration process. I'm going to use my finger instead of my thigh, so I'm not standing up and trying to demonstrate on my thigh. But this does go onto the outer thigh, and you're going to inject it basically where if they were swinging their arm down to their side, that's where it needs to go. So basically the middle of the side of their thigh. And if you can go kind of towards the front of the leg, that's better. So if you imagine that they're wearing pants, okay, and they have a seam that runs down the side of their leg, you're going to go on the upper side of that seam kind of towards the front of their leg, okay? So it goes just on the side of the thigh. You can go through the clothing if you need to. The one thing I'll caution you on is if they're wearing multiple layers, that you need to actually get to the skin rather than trying to go through 2, 3, 4 layers of clothing, okay? It will not go through all of those layers. Okay, so the first thing that you're going to do is you're going to put your 2 fingers in the middle here, and you're going to pull open the device. And when you pull open the device, it comes as 2 pieces like you see on your screen. So on the left of your screen, you'll see the speaker, you see your base. It's like a black base, and it has a red safety guard. So the next step is going to be for you to pull off the red safety guard, and then you put that end, that black end of the device, to their thigh, and you push down. And you push down with some pressure. And you'll hear a click and a hiss once it actually starts to administer the drug. Make sure you leave it in place with that same pressure until it is completely counted down and tells you that that injection is complete, okay? So once you push down, you'll hear a click and a hiss, and then it will count down from 5, and it will tell you injection is complete. Once that injection is complete, you can remove it from the leg, okay, and then slide it right back into the sleeve. So now I'm going to go ahead and demonstrate.
This trainer contains no needle or drug. If you are ready to use, pull off red safety guard. To inject, place black end against outer thigh, then press firmly and hold in place for 5 seconds.
Like I said, I'm going to use my thumb instead of my thigh.
5, 4, 3, 2, 1. Injection complete.
And that's all there is to it.
Trainer.
So all you do is slide it back into the sleeve here, and then you would set that aside and wait for EMS. Now, if you needed to use a second dose of this device, again, you wait 3 minutes, and then you would take another dose out of the box, and you would administer either into the other leg or at least an inch away from where you gave that first injection. And then this is just, again, another visual so you can kind of see how to use the device. But I'm going to just skip over that since we just demonstrated it. And move into the next device, which is the nasal naloxone that has the atomizer that you do assemble. Again, this is a 2 milligram dose with approximately 25 to 30% absorption. This is what EMS typically uses on a daily basis. It is simple to use once you have used it a couple of times and know how to put it together. But just, you know, we'll walk through it, and I wanted you to be able to see kind of what it looks like step by step on the screen. So step 1 is to take the applicator, which is the piece that has the little yellow caps. You're going to take that applicator and remove both ends. So you remove both yellow pieces, and I'm demonstrating up into the webcam as well. So I've removed both ends of that applicator. So it kind of looks like a syringe, but with no needle and no plunger. But in the back of it, and you probably can't see it on your on the webcam, but you can see it on the step 1 on your screen. You can see that little black line that's in the back of that applicator. That's actually a needle that's going to puncture the medication. So I'm going to set this down and show you the next step, which is to remove the cap from the medication vial. So this is the medication vial, kind of like you see in step 2 on your screen. So what you're going to do is remove the cap. And so this little purple cap here, you can just pop it off. And then again, I don't know that you can see it in the webcam, but it's just kind of open. Okay, so it's open in there and it has a little rubber piece. You're going to put that end into the back of this applicator. Okay, so that applicator that we just removed, both of those yellow ends, you're going to put those 2 ends together and you're going to push them together gently and twist. And you twist until you feel some resistance. Okay, when you feel resistance, you stop twisting. And then the last step is to twist on the atomizer on the other end. So once it's all put together, you have your atomizer, which is this white piece that's kind of shaped like a triangle. You have your applicator, and you have your medication vial that's going to become your plunger. So with that person's head tilted back, again, if you have them flat on the ground like we talked about before, they should be in the right position for you to administer naloxone into the nose. So with their head tilted back, you're going to put the applicator into one nostril, and you're going to spray about half of the medicine into one nostril, take it out, put it in the other nostril, and you're going to spray the other half. So it's a 2 milliliter amount that's in here, so you're going to spray 1 milliliter in each side of the nose. And that's considered one dose. So when you get to use if you need to use your second dose, you're going to have to put another one together and basically repeat all of those steps that we just talked about. Now, if one side of the nose is completely clogged and you can't use it to administer, then you can spray all the medication up one side of the nose. It just doesn't absorb as well when you do that, but it's better to have some absorbed rather than none. So, you can spray all of it up one side, and that would be one dose if you needed to. Never reuse the atomizer, which is this triangular piece. So once you use it as a dose, then that goes along with it to be discarded, okay? So you don't want to use that again because those pores in that little atomizer can clog, and then that person may not get the right dose if you had to give a second dose. Also, you don't want to use it between individuals because you can spread disease that way. So it's really important that it's a one-time use for the atomizer. Back to that one, if you needed to give a second dose, like I said, you would put another one together, but again, just make sure that you're waiting 3 minutes between doses. And then the last one that we're going to talk about is the Narcan Nasal Spray. Again, I'm going to demonstrate it up in the webcam. So what you can see on your screen is what it looks like when it comes out of the box. So it's in like a little foil pack. And what you'll do is you'll peel back that foil and you take the device out, and it looks just like this. So once you have it out of the box and out of the pack, it's ready. Don't prime it. Don't try to spray it to make sure it works. Don't do anything to it, or you will waste your dose. There's only one spray per device that looks like this. So once it's out of the box, you're going to put 2 fingers on top, and you're going to have your thumb kind of ready to push that plunger on the bottom. You're going to insert it all the way into that person's nostril with their head tilted back, all the way in until the bottom of their nose touches the top of your fingers. And then you're going to tilt that slightly towards their ear while it's in their nostril and spray, okay? So again, 2 fingers on top, thumb ready to push the plunger on the bottom, but don't push it ahead of time. Put it all the way into the nostril with their head tilted back, and then tilt slightly towards the ear, push the plunger. And that's all it takes. And that is one dose, okay? So once you've given one dose, again, 3 minutes in between doses. You can always be doing rescue breathing in between. And then make sure that you wait with that person until EMS arrives, okay? So you can give, again, you can give multiple doses of these if you need to until EMS gets there. This is West Virginia. Sometimes there's some places that are a little more rural where it may take EMS a little bit longer to get there. But rescue breathing can be a lifesaver with or without naloxone. Sometimes CPR is needed, so chest compressions are sometimes needed. I don't recommend doing chest compressions on everybody because you need to make sure that, one, you've had CPR training or have been somewhat trained to do CPR, but just make sure that it's necessary in that person. Oftentimes in an opioid overdose, the first thing that goes is their breathing, and again, rescue breathing can really save that person's life. So I just recommend, rescue breathing either with or without naloxone. It can definitely save them. Even with naloxone, if you're giving naloxone every 3 minutes, if it takes them 6 minutes to come out of that overdose, if they're not getting oxygen, they could potentially have brain loss or a lot of other things can happen. So if you know how to give rescue breathing, please do. If you don't know how to give rescue breathing, I always recommend taking a CPR class or basic life support type of class so that you can learn how to do those things and learn how to do them correctly. This again is just an image showing what we just talked about, so I'm just going to skip past that and talk about children. So children overdose too. So it's very unfortunate, but it does happen. And again, all of these can be used to save a life in a child as well. The only difference is if you're using the Evzio, which is this auto injector. So if you're using the one that you see in the webcam, then you need to make sure that you pinch that child's thigh muscle, like where you would normally give it in an adult, but you would pinch their muscle if they're less than a year old before you inject it. Okay, that's the only difference with the Evzio. With the nasal sprays, there's no difference in dose between an adult and a child. You cannot overdose someone on naloxone. If you give them too much naloxone and that person has, or that person is dependent on an opioid, they're going to be much sicker with the more you give of naloxone, because it kicks more of that drug off of their brain and causes them to further go into withdrawal the more naloxone you give. So only use the amount of naloxone you need, but, you know, like I said before, administer every 3 minutes when they're not breathing or not breathing well. Okay, so legal protection. So this is something I always get asked about, but if you give naloxone in good faith to save somebody's life and you call 911, you are protected by the law. Okay, it's under the Good Samaritan law. But if you fail to give naloxone, if it is with malintent, meaning you know it's an overdose and you choose not to give it, you could potentially be responsible for that. So you could be liable in that scenario. But of course, you know, if you don't give it and you don't know that it's an overdose, you know, that malintent is not there. So again, as I said before, if you think it's an overdose, they're not responding to you, and they're not breathing, and you have naloxone, please, please, please give it. You could save their life. I would rather be wrong and give it and it not work than to be wrong and not give it, and it could have saved them. So if you think it's an overdose and those things are present, please give it. The second slide when talking about the legal protections is, again, just kind of reinforcing to make sure to call 911 or get them to a hospital as soon as you can. There are 2 brochures that you will receive. So when you pick up your naloxone kit from the health department, so once we send you your certificate, you can take that into the health department to pick up your naloxone kit. And when you get your naloxone kit, you should be given 2 brochures. So one of these brochures goes over the checklist that I talked about, the most important slide that has that checklist of what to do. But it also has a section that goes over the 3 different versions that we talked about today, and it's just a recap of how to use each version. So it's kind of a refresher. So if you haven't used it and you need to use it, that you can take that brochure and kind of refresh your memory as to how to use it. The second brochure actually goes over some resources. So it has the Help for WV number on there, as well as a lot of other phone numbers and contacts where people can get help for multiple things. I think Jobs and Hope link is on there as well, and phone number. So there's a lot of different resources on that, as well as some information about what to do after an overdose, harm reduction, how to recognize someone that may be suffering from a substance use disorder. So there's a lot of different pieces of information that can be useful in those brochures. But you'll get those when you pick up your naloxone kit. So at this point, I just want to see if anyone has any questions. This is kind of the Q&A section. So if you have any questions about the presentation itself, please feel free to put your questions in the Q&A, and I'm happy to answer anything I can.
At this time, I'll turn things over to Lead Project Coordinator Crystal Welch to facilitate the Q&A process. Crystal, are you with us?
I am. Hold on just a second. I have turned off my webcam. I don't guess you have to see me. I'll work with that. Let me look at. We've got several questions actually. So let's just start with the first one. Thank you, Dr. Acree, for this presentation. I attended your training in Huntington about 2 years ago, but I've never used my naloxone. It is now expired. I have 2 questions. Do I need to turn in my expired naloxone, and how long is my certification good?
So we don't have an actual like expiration date of the certifications. I usually recommend that you kind of get a refresher at least every year. I think that's important to just kind of go over how to use it again. Sometimes you learn new information. So I think it's important to try to do that about every year. But if you've used your kit or something like that, or maybe you've used it a couple times, you know, you've kind of had your own refresher. So there's not really like a specific recommendation. Now, when it comes to turning in your kit, you do not have to turn it in. But if you're getting a new kit, that's one way to, you know, safely get rid of it, is to just take it back to the health department to give it to them to dispose of. The other thing you can do is provide it to like a drop center for medications. So most of the, usually in most counties, there's state police or someone that has like a medication drop area where you can take your medications to give them back, so like a drug take back kind of situation. And then of course twice a year we do have a drug take back where you can provide those. I will tell you though that if you are in Huntington, you can take your kit back to the health department and they will dispose of it for you.
Our second question says, what version of the naloxone will we be getting?
So most of the health departments have the 4 milligram nasal, so I'm going to just show it in my webcam. This is what we use for most of our grants. Now, there may be some health departments that have still some of the put together, and then we do have some health centers that have the Evzio. So it kind of depends on where you go to get your naloxone, but most places are going to have the nasal Narcan, the 4 milligram.
The next question says, for the nasal spray, if we need to give multiple doses, do we need to switch nostrils?
Yeah, so if you're using the Narcan, again, this one here, it does help with absorption if you trade nostrils. So if you give one dose in the right nostril, if you give another dose 3 minutes later, do it in the other nostril. Yep.
Our next question says, does a person's weight need to be factored in when giving a naloxone dose? What's the difference between 2 milligrams and 4 milligrams?
So 2 milligrams sometimes is enough. It just really depends. We don't really factor in weight or age or anything like that when we administer naloxone. Typically, you know, it just depends on what they've overdosed on and how much, as to how much naloxone needs to be given to really kind of kick it off of the brain. The more potent drugs, so things like fentanyl and carfentanil are a lot harder to kick off the brain. So when it comes to the absorption of, you know, looking at the difference between these two here, so there's a big difference. So this is a 2 milligram with about 25 to 30% absorption. This is a 4 milligram with about 50% absorption. So a huge change in dose. But we know that they both work really well. So it just may take more of the lower dose naloxone to get them to come out of that overdose.
Our next question says, I heard that pharmacies like CVS will give you naloxone free of charge as long as you have a prescription. Is that true? And do you need prescription drug coverage in order to get that? Okay.
So most pharmacies will run it through your prescription, with or without a prescription. So they'll run it through your insurance. Even if you don't, like if you go in and you just say, I want to get naloxone, I don't have a prescription for it, they can still bill your insurance through a statewide standing order, but also through legislation. So they can bill it, and it just depends on your insurance. So it's not typically free of charge. If the person has Medicaid, it's usually no more than $3. It just depends on their plan. But with commercial insurances, we see it all over the board. We see it as cheap as $10 or $15, and as expensive as $70 or $75. So it just depends on the insurance. And that's why I usually try to kind of push people towards going to a health department or something like that to pick up their naloxone if they don't have Medicaid, because it just depends. Like I said, it just depends on the insurance. And health departments are typically, they're going to give it for free because it's grant funded. So if they have it, I would say go there first. If they have Medicaid, they can usually get it pretty inexpensively in the pharmacy.
Our next question says, can you get stuck with the needle after you administer the naloxone?
So with this one, typically no, it does retract back. There's always the potential that it could malfunction and be, partially sticking out. But that's why we slide it right back in this case. So as soon as it's used, so when you use this, you just put it right back in the case as soon as you're done using it, and that prevents anybody from getting stuck.
I don't think you've answered this. I apologize if you have. This one says, can you use expired naloxone?
So that's a tricky question. I can't tell anybody to use it because it is expired. But what we do know is that something is better than nothing. Okay, so I always just recommend that if someone has an expired kit, to hold on to it until they get their new kit, because if that's all you have, that may be better than not doing anything. We do know that from studies that it typically does keep its potency for a good amount of time after the expiration date, but just as a pharmacist, I can't tell you to use it after the fact. It won't hurt them, though.
We still have more questions. I've heard that, I've heard about first responders being exposed to potent carfentanil and fentanyl as they're trying to administer Narcan. Should we wear gloves when we administer naloxone? What measures should be taken for protecting ourselves?
Absolutely. So that is something that I apologize, I didn't mention at the beginning. I typically do. But with any of these versions, make sure that you use gloves if you have gloves handy. Protecting yourself is first and foremost. I'll typically carry my naloxone with a pair of gloves because I think if I'm ever going to need to use it, I'd like to have gloves on me. Or if I'm responding to someone, it's better to protect myself because I may come in contact with body fluids as well. So wear gloves. Obviously, first responders are at a higher risk because they're responding to these on a daily basis. But it is important that if you, by some think that you've gotten something on your skin, so if you feel like you've gotten powder on your skin or anything where you think, oh my gosh, maybe I touched some fentanyl or something, wash your skin. Wash it with soap and water. Do not use hand sanitizer. So it's important to use soap and water, get it off your skin. If you don't have soap, at least use water to try to wash it off your skin. If you use hand sanitizer, it actually kind of spreads the surface area and can cause it to absorb quicker. So I would say just wash with soap and water if you think you've been exposed to something. Again, with the injectable, there's going to be blood. So it's a needle. Their leg might bleed. So just be careful. Don't touch their leg after you've injected just to make sure that you don't expose yourself to something.
What if I leave naloxone in my hot car? How hot is too hot? Is it still good?
If it has been left in your hot car for maybe once or twice, it's probably not going to have broken it down enough to not be useful. But if you've done it pretty consistently, especially where it's exposed to the sun, I would say you probably need to get it replaced. So even though it doesn't really get really hot in West Virginia, I mean, we get to maybe 100 degrees, 102 at the most. You have to think about inside of a car, and especially when the sun's beating down into the car, it can get really, really hot. So naloxone typically breaks down at around 150 degrees. It could be a little bit before, a little bit after, just depending. But it's better that if it's been left consistently in your car, just get it replaced just to be safe.
All right, and we have a marathon. We've got 4 more questions. Okay. Let's see. Where can I get the nasal sprays? I think you might have already covered that one, but go ahead and maybe restate that one.
We have everyone's email address that has registered for this, so I will be sending out a certificate showing that you've had the training along with a list of locations where you can get your naloxone.
All right. I am opening a recovery residence in the spring and want naloxone kits readily available. Are there channels where nonprofit recovery residencies can obtain naloxone kits at low costs?
So it depends on how many they need, but we are really trying to make sure that we can get naloxone to individuals that need it. So if there's recovery homes that need naloxone, either we can try to get it through grants or we can try to work with the local health departments to make sure that they have it on hand.
All right, two more real quick. Are there any concerns about transport or administration outside of West Virginia? For example, my partner and I do events outside of West Virginia. If we were to use for an example, Ohio, would that be an issue? Or if I get pulled over in Virginia?
I would have to look at both Virginia and Ohio laws to make sure. Typically, it is not considered paraphernalia or anything like that. It's always a good idea that if you are traveling outside the state, to at least keep it in its original box with the label on it. And usually you do get a label anytime it's dispensed to you. You should have a label on it with your name. So just keep it in the original container with the label, and you should hopefully be okay if you get pulled over.
All right. We're still rolling with questions. My staff is attending this training. Will they or can they receive certificates to show that they attended? Thank you for the presentation. And by the way, this was very helpful.
Well, great. Thank you. And yes, we will send you certificates as soon as we get everything uploaded from WebEx. So when we have the list and everything, which I'm not sure how long that'll take, but I would say within a couple of days, you should have your certificate and be able to go to the health department to pick up your naloxone.
All right. If we have time for two more real quick, what do you mean when you pinch a baby's thigh?
So I always say pinch an inch. I'll show you on my arm here. So you would want to pinch a section and be able to inject it into that pinched area. The reason for that is because they have really small thighs when they're less than a year old. So you want to make sure that it goes into the muscle, and it's a needle that's big enough for an adult. So you just pinch up that muscle and then inject into where you pinch. Just be careful not to inject yourself.
Last question. I've heard that doctors give Narcan prescriptions when they give a prescription of opioid. Is this true?
Some do. I think that all should. I think it's extremely important that everybody has it because there's always the potential for accidental exposures. So if you have if you have an opioid in the home, you really should have naloxone in case someone takes too much or if a kid gets a hold of it or something like that. And I do have two other questions. Is that okay if I answer those quick?
Yeah, please do.
If you're interested in becoming a trainer, I do see that question. When I send you your certificate, just reply back to me that you would also like to do the train the trainer. And then I think I already answered the storage question, but just try to keep it away from extreme temperatures. So even frozen temperatures, just try to not let it freeze if you can. Doesn't completely ruin it if it freezes, but of course you can't use it if it's frozen liquid.
All right, we'll turn it back over to Shannon.
Thank you, Crystal, and thank you so much, Lindsay. And thank you all for joining us today for naloxone administration training for the end user. As you exit WebEx today, you will be directed to a short 3-question evaluation that we would really appreciate if you would take the time to fill out. WebEx it'll look like a warning when you're going to an external site, but really it's just a SurveyMonkey link. And if you could fill that out for us, that would be very helpful so that we can perfect our trainings and deliver the types of information that you would like to learn more about in future webinars. We also have contact information here on the screen for everybody who has been featured in today's webinar. If you would like more information, you can reach out to us, or as Lindsay indicated, next week you will receive a certificate for your participation in today's session. So be on the lookout for that. And if you have any questions or comments about anything presented today, please reach out at Lindsay Acree at ucwv.edu, swright at qualityinsights.org for me, mdyke at qualityinsights.org for Misty, or cwelch at qualityinsights.org if you would like more information from Crystal. With that, we will wrap up today's session, and we would like to thank you again for attending Naloxone Administration Training for the End User. We look forward to seeing you in future webinar presentations. Have a great day.